Hi, this is Patrick Horn, president of GAP. Thank you to our sponsor, Ardelyx, for their support of this FAQ video module.
Hi, my name is Amy Ladewski. I'm a physician assistant at Northwestern Memorial Hospital in Chicago, Illinois. I focus on neurogastromotility disorders and disorders of gut-brain interaction, and it's a pleasure to speak with you today. I will be addressing the question, how do you develop a treatment plan for irritable bowel syndrome with constipation? And what are some key considerations in choosing the right treatment plan? When I see a patient in clinic, it's important that you really know their health history, their psychosocial history, the medications that they are on, as well as medications that they have potentially previously attempted and failed to target their irritable bowel syndrome with constipation. For example, if a patient has already tried over-the-counters such as polyethylene glycol and stimulant laxatives, then it's time to move on to those FDA-approved therapies. Additionally, we have to be targeting symptom profile. There's not a one-size-fits-all treatment approach for patients with irritable bowel syndrome with constipation. We know that the pathophysiology is complex, and what might work for one person may not work for another. We have to look at their symptom profile. What is their most bothersome symptom? Is it the constipation? Okay, then we need to be making sure that our laxatives are strong enough to target that. Or is it our abdominal-related symptoms, where we're using these FDA-approved therapies over the course of a few months to really optimize improvements in the abdominal pain, bloating, and distension? Furthermore, we need to look at their health literacy. Are they understanding what their diagnosis is and how to utilize these medications and potential other interventions into their daily life? Unfortunately, insurance is a factor in potentially selecting those first agents for the patient, but fortunately, we have a lot of great options. When I see patients in clinic, the patient population is quite complex. They typically have overlapping psychiatric mood disorders such as anxiety and depression. They've had IBS for decades and can have quite a significant perseveration, fear, and isolation. These patients likely would benefit from receiving brain-gut behavioral therapies such as GI gut-directed cognitive behavioral therapy and hypnotherapy. I ensure that I take some time to discuss with them the gut-brain axis and the importance of addressing that piece of their therapy to really holistically treat their global symptoms. Additionally, patients may be hyper-focused on diet. They've attempted and failed multiple dietary interventions, or they've never tried dietary interventions before. So I'd like to ask what they've done. Have they tried lactose-free, gas bloating diet? What is their knowledge of the low FODMAP diet and targeting abdominal-related symptoms? If they feel a little overwhelmed or confused or want more information, it's really important to partner with a GI dietitian to be able to address their dietary concerns. Furthermore, many of my patients with irritable bowel syndrome with constipation may have overlapping dysenergic defecation or a functional defecatory disorder, and this can be frequently overlooked. So when my patients are not responding well enough to their optimized FDA-approved therapy, I want to ensure that we're addressing what could be possible dysenergic defecation with further testing with an anal rectal manometry balloon expulsion testing. And if that's positive, talk with them about that link and refer them over for pelvic floor physical therapy. In summary, irritable bowel syndrome with constipation is a complex condition with an individualistic, holistic approach for patient care. We need to be targeting their laxative therapies, but also their brain-gut behavioral therapy, their nutrition therapy, as well as potentially pelvic floor physical therapy. Thank you for listening. Please visit the GAP website and app for further information.